This is a demonstration video on how to prone your patient using the MaxiMove Lift and hanger bar. Once face and body prep have been completed, gather supplies, set up room, and assemble team. Supplies needed are 2 repositioning slings, 2 flat sheets, incontinence pad, pillows, ECG leads, and pocket slider. Note, for bariatric patients, they will require a bariatric pocket slider and an additional clinical support person. Begin by setting up room. Position bed at an angle away from the wall. This will allow our team to be positioned at head of bed. Remove headboard and place backboard or headboard between mattress and frame. This will hold the prone pillow. Ventilator, IV pumps, tube feeding pump position near head of bed. Urinary catheter, after emptying, and FMS will be positioned between patient's legs. Supplies should be located near end of bed. MaxiMove and hanger bar will be positioned at head of bed opposite a ventilator. Begin by raising bed, lowering all side rails. As part of your team, you'll have respiratory therapist positioned at head of bed, stabilizes head and maintains airway as patient is positioned prone supine. Team leader positioned at side of patient directs team during pronation and supination. Patient nurse assists in pronation and supination of patient, may or may not be team leader, responsible for assessing patient and reestablishing monitoring. Lift operator positions lift at head of bed opposite a ventilator, responsible for operating lift and double check safety of sling attachment. Ensures lift is locked when operated. Additional clinical support of 1 to 2 is needed to assist the team with supination pronation of the patient while ensuring safety. Minimum of 4 persons. Address the patient and explain the procedure. Turn the patient side to side and roll the repositioning sling under the patient, making sure the sling is high enough to hold the patient's head. The primary nurse will direct the team to disconnect, remove any unnecessary tubes, equipment on the anterior aspect of the patient. Position the MaxiMove bar parallel over patient and lock lift wheels. The patient will be turned towards the ventilator. Time out with your team, making sure everything is in place before going into the proning process. Attach the sling handle straps to the MaxiMove hanger bar using all white hooks, 6 upper and 6 lower. Note, for wider patients, gray hooks can be used if needed. Hooks opposite of the ventilator should be attached first. Lift patient upward in the sling just high enough to place the second repositioning sling, flat sheet, and incontinence pad. Assess that sling edge is lined with the top of bed, positioned under patient's shoulders, not under patient's head. Then place pocket slider, position shoulder to bum onto the sheet positioning it slightly closer to the MaxiMove side. Pull patient to edge of bed away from the ventilator and upward so that shoulders are lined with the top of bed. Lower patient onto bed. Once patient is lowered, detach sling straps on the ventilator side. Position straps towards patient's feet, then roll sling and pocket slider downward, tuck in underneath the patient. Raise the lift while a coworker opposite of the ventilator assists the patient in the prone position by pulling on the sling. Clinical workers on the ventilator side will use the patient's bottom sheet to guide the patient's turn slowly and safely. RT will guide the patient's head while stabilizing the airway. Lowering the bed will also assist in turning the patient into the prone position. Once in the prone position, remove pocket slider. Time out. At this point, team members can reestablish monitoring by applying electrodes to the back of the patient. Once in the prone position, quickly lower and remove the repositioned sling that remains attached. Position the bar parallel over patient and attach the repositioning sling the patient's lying on using all-white hooks. 6 upper, 6 lower. Note, again for wider patients, use gray hooks. Lift patient in the air and position the patient overhead of bed, coordinated with the prone pillow. Place a flat sheet under the patient with prone body pillows on top. Place foam and 1 single pillow under the chest, 1 double pillow under the hips, and 1 single pillow under the shins. Remember, foam to chest. Lower patient onto bed. Before removing straps, ensure patient's high enough onto the prone pillow so that chin is not resting on the mattress and body appears in alignment. If patient needs adjusting, lift the patient into the air and reposition the pillows or pull the patient upward as needed. Once patient is in good alignment, raise the foot of bed fully to prevent slipping and reverse Trendelenburg bed 10 to 12 degrees. Remove sling straps from lift. Time out. Primary nurse will assess the patient and RT will assess airway. Assess the patient's head is in proper position and pressure points are addressed. Patient will be positioned in the swimmer's position. 1 arm up and 1 arm down. Be careful not to overextend the joints. Primary nurse will reconnect any tubing. This concludes our proning video.